So you all are leaders in your respective fields. What advice would you have for, in your case, a physician leader or a health plan leader or a research and innovation leader on the medical device front for colleagues of yours that may be undergoing some of the same things around the country? We'll start with Robert, if you don't mind.
Well, we've hit a lot of it. I think be super focused on what you're trying to achieve, right? So healthcare has to continue to evolve. There's no doubt how it looks today is not how it's going to look 10 years from now or 5 years from now. And if we continue to, if you're not focused on how we're going to innovate, how we're going to drive it, where am I going to invest, and it should be somewhat, I think one of my vices is stuff that I try to follow myself, should be somewhat core to what you already do. And I'll give you an example of that. When we started doing AI and all of the digitizing the processes, we started inside. We didn't push it outside. So we looked at how our call member service people were doing stuff and how can we invest there to innovate. And when that started to add value, then we pushed it out. Now we have 20% of our stuff's coming through chat now with AI-enabled messaging. Awesome. But we had to start internally first, and we learned that way. So that's my advice. I know not for a really long answer, but make sure it's core and be committed. I think you have to be committed to it.
Sherry, your thoughts?
I'm going to take you full circle to where I started. Build a fear-free environment.
Like that.
Yeah.
And a diverse team, and then the final thing is to have a balance, not just a diverse portfolio, but a balanced portfolio, because from where I sit with my team, if we only go after, long term, we're out of business. I mean, it's just the reality of the situation. So we have to really look at what percent of short-term innovations are we going to focus on, mid-term, long-term, and make those decisions. And sometimes those are really tough decisions to make.
Yep.
I would
Charlie?
say, from a care delivery perspective, medicine's going through the biggest transformation it's ever gone through in its history of care delivery, in a good way. And I think those healthcare systems, and I applaud Piedmont for its energies in doing this and coordinating care, putting quality in the first at the core of the mission, and then bringing the physicians and all the caregivers, the nurses, the nurse practitioners, everybody on the care team together around a common focus. And again, with quality driving the overall intensity, we've been able to demonstrate an improvement in quality, a reduction in the cost of care, and an improvement in the patient experience. And it's going to take some coordination. It's very different than the way even myself, when we trained in residency, that you were an individual practitioner. It's really not like that anymore. You're part of a care delivery team, and you need to accept that.